Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Marilah kita memanjatkan puji syukur kehadirat Allah Subhanahu wa taala karena atas segala rahmat dan karunia-Nya sehingga kita dapat kembali berkumpul di tempat yang penuh berkah ini Sabtu 12 Maret 2022. Semoga salawat dan salam senantiasa tercurah kepada kekasih Allah yang mulia, Nabi dan Rasul Muhammad Sallallahu Alaihi Wasallam, juga atas keluarga, sahabat, serta para pengikutnya hingga akhir zaman. Amin ya Rabbal Alamin. Bapak Ibu yang berbahagia, selamat siang dan ahlan wa sahlan kami ucapkan kepada seluruh peserta yang telah berkenan hadir baik online maupun offline pada webinar The Qatar Experience Healthcare for People with Special Needs. Saya Muhammad Fazlur Rahman Syarif akan membersamai hadirin sekalian pada siang hari yang penuh berkah ini. Izinkan kami menyapa yang terhormat Bapak Duta Besar Republik Indonesia untuk Qatar, Ridwan Hasan, Ketua Dharma Wanita KBRI Doha Ibu Lita Ridwan Hasan, Consultant Intellectual Disability and Developmental Disorder Dr. Hesham Rustom, Psikolog and Co-founder Sahabatku Ibu Dina, Ketua Pernikah Bapak Ahmad Sarnubi Fatah, Perwakilan PPI Qatar, Dharma Wanita Persatuan di seluruh perwakilan yang hadir, dan yang kami banggakan seluruh tamu undangan baik yang hadir online maupun offline. Beri tepuk tangan yang luar biasa untuk kita semua. Agar webinar hari ini dapat berjalan dengan lancar, kami harapkan kepada seluruh peserta webinar yang hadir online untuk mengaktifkan video dan menonaktifkan mikrofon selama sesi webinar berlangsung. Kepada peserta yang hadir offline, kami harapkan pada Bapak Ibu tetap melaksanakan protokol kesehatan, menjaga jarak dan menggunakan masker. Adapun susunan acara pada siang hari ini adalah pembukaan, menyanyikan lagu Indonesia Raya, sambutan, pemaparan materi oleh narasumber dan sesi tanya jawab, penyerahan plakat dan penutup. Baiklah, melangkah ke agenda selanjutnya. Menyanyikan lagu Indonesia Raya. Kepada para hadirin dimohon berdiri.
Indonesia, tanah airku, tanah tumpah darahku. Di sanalah aku berdiri, jadi panggul ibuku. Indonesia, kebangsaanku, bangsa dan tanah airku. Marilah kita berseru, Indonesia bersatu. Hiduplah tanahku, hiduplah negeriku, bangsaku, rakyatku semuanya. Bangunlah jiwanya, bangunlah badannya untuk Indonesia Raya. Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang kucinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya. Indonesia Raya, merdeka, merdeka, tanahku, negeriku yang kucinta. Indonesia Raya, merdeka, merdeka, hiduplah Indonesia Raya.
Hadirin dipersilahkan duduk kembali. Selanjutnya, mari kita sama-sama dengarkan sambutan yang akan disampaikan oleh Duta Besar Republik Indonesia untuk Qatar, Ridwan Hasan. Pada Bapak, kami persilahkan dengan hormat.
Terima kasih ya. Terima kasih Pak Fadlus. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, salam sejahtera buat kita semua. A very good afternoon to everybody. With your permission. Dr. Rustom, we are very honored today. You are joining us at a very important session, sharing about on issues related to our children. This is really significant for us. And as a procedure of our activity today, I would like to deliver a short remark in gracing this event. Yang terhormat Ibu Ketua Dharma Wanita, Ibu Dita Kadatin, dan tentunya juga para Dharma Wanita dari berbagai perwakilan Indonesia yang ada di luar negeri. Saya di bahasa Indonesia. Yang terhormat Ibu Khadijah, yang mewakili perwakilan Parent Support Group, dan Ibu Fajri, Ketua PSG, yang hadir secara online. Yang terhormat Bapak Syarul Bifata, Ketua Persatuan Masyarakat Indonesia di Qatar. Yang terhormat Bapak Ibu anggota DWP tadi sudah sebutkan. Yang terhormat Ibu-ibu, Bapak-bapak sekalian yang hadir pada acara siang hari ini, baik offline maupun online. First of all, I would like to thank you very much for your presence in our event today. We highly appreciate it, and this is a result of our discussion sometimes. Secondly, with your permission again, I will deliver my remark in Bahasa Indonesia, in our language, because we have so many audience from Indonesian audience from different part of the world. Bapak Ibu yang terhormat, pertama-tama saya ingin menyampaikan rasa terima kasih atas kehadiran Bapak dan Ibu sekalian di dalam acara ini. Saya lihat selain yang hadir langsung di tempat ini juga beberapa peserta dari berbagai negara online ikut menyaksikan acara ini melalui layar Zoom yang ada di depan kita. Qatar, sebagaimana diketahui, adalah salah satu negara dengan standar kesehatan yang terbaik di dunia. Salah satu bentuknya adalah pelayanan kesehatan kepada mereka yang berkebutuhan khusus, yang diantaranya adalah anak-anak kita, termasuk kepada anak-anak dengan sindrom autism. Berangkat dari pengalaman saya pribadi, dan istri saya tentunya, keluarga kami, tidak mudah untuk menemukan pusat layanan kesehatan yang memiliki spesialisasi untuk anak-anak berkebutuhan khusus. Ini adalah satu tantangan yang tidak ringan, terutama ketika kita berada di Indonesia. Oleh karena itu, saya melihat pentingnya kita untuk saling berbagi pengalaman dan pengetahuan terkait hal ini. Dr. Rustom, yang pada saat ini, yang pada hari ini akan menjadi pembicara kita, adalah salah satu pakar untuk pelayanan kesehatan bagi anak-anak berkebutuhan khusus di Hamad Mental Health Centre. Insya Allah, beliau akan bercerita bagaimana pengalaman Qatar dalam memberikan layanan kepada anak-anak berkebutuhan khusus. Yang alhamdulillah, Izzata Fitra, salah satu dari anak kami, telah menjadi anak yang mendapatkan perhatian dari beliau. Jumlah anak-anak berkebutuhan khusus di dunia cukup signifikan. Data dari PBB menyebutkan sekitar 10% dari jumlah anak usia sekolah di dunia ini memiliki kebutuhan khusus pada berbagai level, pada berbagai tingkatan. Di Indonesia sendiri saja tercatat sekitar 1,5 juta jiwa anak-anak memiliki kebutuhan khusus. Dengan jumlah itu, di mana sebagian di antaranya adalah anak-anak usia sekolah, kita perlu melakukan cara-cara luar biasa untuk menanganinya. Dan bapak-bapak dan ibu-ibu semua adalah orang tua yang luar biasa tentunya. Ya. Satu hal yang harus kita garis bawahi bersama untuk mengadres masalah ini adalah perlunya kolaborasi kerjasama. Untuk mengadres masalah ini kita tidak hanya perlu dukungan pemerintah, tetapi juga perlu dukungan dari masyarakat, khususnya para keluarga dan sahabat-sahabat kita atau lingkungan di mana kita bertempat tinggal. Oleh karena itu, pada kesempatan ini saya juga ingin menyampaikan apresiasi kepada salah satu kelompok masyarakat di Qatar, yaitu Parent Support Group, yang telah tanpa lelah berbagi pengalaman dan berbagi solusi dalam mengasuh dan mendidik anak-anak berkebutuhan khusus. Tepuk tangan. Pendidikan dan layanan kesehatan untuk anak-anak berkebutuhan khusus tentu harus inklusif. Alhamdulillah di Qatar ini beberapa fasilitas kesehatan dan pendidikan untuk anak-anak berkebutuhan khusus relatif tersedia dengan baik. Nanti Dr. Rustom, silakan ibu-ibu, silakan. Oh, adik-adik, ini student kita ya. Nanti Dr. Rustom akan bercerita bagaimana pelayanan yang diberikan oleh institusi di Qatar dalam menangani anak-anak berkebutuhan khusus. Saya tidak akan mengambil waktu yang lebih panjang lagi, tapi izinkan saya menyampaikan sedikit dalam bahasa Inggris, terutama untuk kebutuhan Bapak Dr. Rustom. As I mentioned before, I'm very happy as we can finally organize this event with your support certainly. As you may know, the number of kids all over the world, according to the UN statistic, of kids possessing this problem, this autism spectrum disorder or special needs, is about 10% of the kids. This is big numbers. And Indonesia alone has around 1.5 million children with this kind of spectrum. So today's event certainly is very important for us. Therefore, we, the government, as well as the parent, need collaborative effort to address these challenges. As you may aware, in certain countries, not all the kids with special needs have access to inclusive health and education services. And here we are lucky, at least step by step, we got the first the opportunities and facilities for them. Alhamdulillah, in Qatar, the government has paid high attention in this issue. In this case, with your long and special experiences, I hope you may share with us on how Qatari authorities, particularly in health sectors, could deal with this problem. Again, Dr. Rustom, on behalf of myself, on behalf of my office and my community here, we are really honored to have you with us. Barakallahu fikum. Syukran kathiran. Assalamualaikum warahmatullahi wabarakatuh. Terima kasih ya Bu. Terima kasih Dr. Also medical doctor, Dr. Kenya. Yes, he is very active also with us here. Thank you. Silakan. Siapa sekarang? But when you speak, you don't have to speak in bahasa Indonesia. Just silakan.
Terima kasih kami sampaikan kepada Bapak atas sambutannya. Selanjutnya, sambutan oleh Ibu Khadijah Alwi, selaku perwakilan dari Parent Support Group Qatar. Pada Ibu, kami persilahkan dengan hormat.
Silakan.
Your Excellency, the Ambassador of Republic of Indonesia to Qatar, Mr. Ridwan Hassan, and Mrs. Lita Kadar. Our distinguished special guest and key speaker, Dr. Hesham Rustom, Chairperson of Parent Support Group, Qatar, Ibu Fajriati Badruddin, Chairperson of Parmika, Mr. Ahmed Sarlubi Fatah, Representative of PPIQ, Indonesian Student Association in Qatar, Representative of Dharma Wanita Persatuan from various countries, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, assalatu wassalamu ala Rasulillah sallallahu alaihi wasallam wa ala alihi washabihi ajma'in. It is a truly great honor for me to deliver this opening speech on behalf of Parent Support Group Qatar. In this event, with the theme, the Qatar Experience, Healthcare for People with Special Needs, organized by Indonesian Embassy in Qatar and Parent Support Group. Before we start the discussion, please allow me to introduce what is the PSG, Parent Support Group. Parent Support Group is an association for parents, professionals, and observers with aims to share experience and information that should be useful in educating and raising children with special needs. PSG expects to be a close partner to the parent to fight together and to help the children to be more independent and to have quality life in the future. PSG Qatar was initiated and facilitated by several parents whose children with special needs on 23rd February 2008. The first grand meeting was carried out attended by 15 parents, which they are agreed to establishment of Parent Mobilization Action Group, later on widely known as Parent Support Group. The consists of parents. The member of this Parent Support Group now is 35 parents with the special need and with the different issues. Now the PSG welcomes to this webinar topic and hopes all participants will obtain knowledge, benefit, and better understanding about Qatar experience in dealing with the healthcare for people with special needs, as well as its service, mechanism, and scheme. So, saya harap nanti ibu-ibu setelah ini bisa tahu servisnya apa yang mereka sediakan, mekanismenya seperti apa, kemudian skemanya bagaimana. Jadi banyak-banyak pertanyaan ya Bu ya. Jangan diam.
Confidential.
The big hope. Okay. The big hope as an aspiration for us would be the opportunity for expatriates, especially Indonesian, to have better access to Hamad facilities and service for their specialist need family member. Last but not least, on behalf of PSG Qatar, I'm glad to welcome all participants. I hope that we can all leave this gathering with a renewed commitment to support children with special needs. Thank you.
Very good speech, Ibu. Wow. Like in UN, like semangat.
Terima kasih kami sampaikan Ibu atas sambutannya. Selanjutnya, mari kita memasuki acara inti webinar hari ini. Sesi kali ini akan dipandu oleh moderator Ibu Dina, psikolog and co-founder Sahabat Group. Kepada Ibu kami persilahkan dengan
I don't want to make things awkward.
Yes.
Let's just clap our hands first. Okay. Let me just open it.
Yes. Otherwise.
Otherwise, I cannot speak properly. Okay. Alhamdulillah, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
So I'm Nida. I will be moderating today's session. But firstly, I'm so very happy to hear about our distinguished guests, and especially Your Excellency, Bapak Ridwan Hasan, the Ambassador of Republic of Indonesia to Qatar, Ibu Ridwan Hasan, the Chairperson of Dharma Wanita Persatuan KBRI Doha, Ibu Fajriati Badrudin, Chairperson of the Peer Support Group Qatar, joining us online from Jakarta, and the Bapak Ahmad Fatah, perwakilan dari, bukan perwakilan, ini ketua Indonesian Association Community here in Qatar, Dr. Rustom, of course, who will be our key speaker for today's event. And of course, last but not least, to all the parents here joining us from Parent Support Group Qatar. Dr. Rustom today will be delivering a speech or a sort of presentation about healthcare, about Qatar's experience in providing healthcare for disabled person in Qatar. He will be explaining in detail about the sort of care that the Hamad Hospital is providing for all of us here. And hopefully from this speech, we will get to know the kind of services that might be available, especially for Indonesians here in Qatar. So without further ado, I would like to welcome Dr. Rustom. You can sit
Wherever you want. This is your home, Doctor.
Jadi barangkali tidak perlu terlalu kaku ya Bapak-Bapak dan Ibu-Ibu.
Kalau beliau merasa kurang nyaman,
Stand up or sit down.
You can stand up or you can stand up.
These people will
feel free.
have to look at.
Would you be more comfortable
Maybe
here?
they're here.
Yes.
Okay.
Come there.
No, people will get to see my face.
Okay. Right. So the presentation is ready.
Yeah.
So you want to start?
Yeah.
Okay.
Yeah.
Just keep it on the first slide.
Oh,
Just the first slide. Thank you very much for generous introduction. My voice is clear for the webinar, for the internet. Thank you very much for the generous introduction.
Excuse me, can you increase the volume?
The volume.
The volume, just the volume.
Okay.
Increase.
Actually, I am impressed with the audience coming here. And I'd like to say to you that I'm not used to be with a lovely, friendly, sociable people like you. Sometimes, most of the time I present our conference or a medical, society where people are grim like this, like this. They want to ask me questions, and they come from a Friends Day for the whole conference. So, but like this, I like it. Welcome. Of course, I'd like to introduce myself. I'm a consultant physician. Started my career after graduation from medical school. I went to done general medicine, and then after general medicine, I've done some experience in general psychiatry. And then after general psychiatry, I've done specialist training in England. So the learning disability or intellectual disability, people 3 years where I had that experience, and then I had worked in England for the period of 20 years. I'm originally from Palestine, but the time when I spent before I went to England, I like to come back to the Arabic world to deliver my experience here. And I found Qatar is a kind of a place that I could deliver something because of the background as well. Because of my experience in England has developed to the way that I could give something to the society. Now, my experience is around now I'm working effectively with people with disabilities, and particularly people with, as the Excellency Ambassador mentioned, that people with autism is a group of people that I look after. This group of people, of course, there are people with genetic syndromes, people with Down syndrome, with Prader-Willi, with people who are born with these syndromes. Of course, I look after people who are subjected to cerebral palsy, human birth. Of course, the people are having some kind of brain injuries during childhood. So I think this is a group of people I look after in this specialty. Right. So we're gonna take like maybe 45 minutes, and then we can leave it for questions. You can ask questions, yeah? 45 minutes maximum, and then we can do some questions. So we would like to, sorry, it's not coming. This talk. How can we go down in the slides? Because there is something. It should come like in the slide. No, back the first slide. The first slide. Yeah, it should. No, wait. The second. Yeah. Yeah. Next one. Yeah. It should. I think it should come like with like
An animation?
Animation. Yes.
Oh.
Yeah.
Ada nggak, Pak?
No animation. Can I just check? I can open the second slide. This one. Can you keep this way? It's okay. Yeah. Yeah. Right. So can you make it slideshow, or it doesn't come like slideshow? Doesn't come. Okay. Can you make it bigger? Bigger. The whole. Okay. Full screen. Huh? Okay. Okay. Right. So we're gonna talk first about the concept of the intellectual disability, and talk about the human rights. Little brief about the expansion of the service in Qatar, what facilities we have, and then we're going to talk about then the causes of disabilities, and an assessment, how we render the assessment, how we do our work, and the last thing is about the treatment options. Next. Yeah. Okay. Right. So, of course, people with disabilities, as we talked about, it might be, first the intelligent level test. It shows that the IQ level, or the standardized intelligence test, shows like the intelligence is less than normal. The normal is around 70. So if we count these people as disabled, they have to score under 70 in the IQ test. So it's something we know that we do it all the time. The other thing is around that, are they able to live on their own, or they need an assistance, they need support? These people must need support. If they don't need support, that means they don't have disability. So there are two things we have to look at: their intelligence level, and plus they can't live on their own because they are disabled. But of course, the people can, for some time, can have an IQ test over 70, okay? But they still can't live on their own because some people, they have communication and social disorders, like people who have an ability to understand the conversations correctly. We have these kind of highly functioning, we call them Asperger's syndromes. So this is an exceptional group of people. So we can move next. Right. So these people, as I talked about, is around people who have autism mainly, who have ADHD, which is an hyperactivity disorder. I'm sure that you know these terminologies, I'm sure, yeah? Yeah. And genetic syndromes, people who are born with, particularly with the features are different from others. They usually come with a genetic, could be inherited or could be just for the first time, okay? Cerebral palsy also, when the birth has been complicated, so people, the child or the fetus comes like with the neck like this, and they try to pull him, you know, and then, or try to, it's difficult birth, it might lead into fractures here and there, or it could be the forceps, like when they pull the head, maybe a pressure on the head, or the child will be incubated, and the incubation for some time, this might lead into a brain damage. So might this be one of the things that the child will grow less than others, will be progressing less than others. So they then develop this intellectual disability and physical disability, and then this will be lasting for the most of their life. Sometimes, you know, mental illness is part of the, you know, the assess and work I'm doing, and we're doing in our team. Of course, we have the physical disabilities combined with the mental disabilities, and of course, we can get involved with sometimes with some forensic aspects and courts, because these people, they might be in trouble sometimes by, you know, being with the interacting with the people in the public, and they might do something silly, or they might do something wrong. So the police will come and say, look, you know, you shouldn't do that and do that. Sometimes the courts write to us because a person needs a social assistance. They might need, the court might send to us because somebody has millions or money in the bank, but they can't take decisions. So we are involved as well. I do the reports for these people. So we can remove this next. Yeah, okay. Yeah, can we just, yeah. I think we can go back to the screen. Yeah, because this is, I think it's finished. No, we can go back to full, to the screenshot. Screenshot. Yeah, all right. The rights for the people with disabilities is quite important. So historically, the person with intellectual disability have been denied the right to live in the community sometimes. Marriage is a big problem for them because of decision taken, because of inability or ability to manage their affairs. You know, work is a problem as well. We need to know how much they can work, how much support they need at work. This is really not an easy thing to do. There are things like education, what kind of education, level of education. They need to be supported during this life. Of course, during these years, they've been, you know, treated unfairly. But now the world is becoming more aware about this problem, and the institutions and ministries are given some attention by law, and also, but sometimes implementation can be difficult. Sometimes it might be even in Qatar here. Yeah. Okay. I think I can move from here, maybe. No, you can move from your side. Yeah. Can you move to the next one? Yeah. Okay, so there are rights to be employed, educated. This is what we talked about participation in the public societies and the leisure and all this. Can you move to the next one, please? Next. Yeah. These people also have rights to know where they're gonna live, who we're gonna interact with, to do things as they wish. Is that we don't need to take we need to give them some freedom, actually. And I always say to my team, I say, like, give them the freedom as long as they are not at risk. If they are at risk, we have to intervene. I mean, if they've done something wrong, I mean, if it's something, it can be allowed for some little flexibility. Give them the time, give them the way. But I think insisting on this is right, this is wrong, on everything, it's going to be stressful on them. Even if they've done something wrong, you can leave them do it. But they can just go back to it later, or don't remind them, just leave them do it, as long as they are not posing risks into self and others. Yeah, next. Now, Qatar is around 2,800,000 now, and the next, please. Yeah. And it's growing.
There's some people listening online, and the mic is just right over there, so it might be better.
Yeah. Okay.
Thank you.
So yeah, this one here. Yeah. So it's a growing society. It's actually the most growing between the Gulf areas. Is 23%. Yeah, between 2000 and 2018. In comparison with Kuwait and Emirates, it's growing. That's why services is more implemented and they're expanding. Okay, next. Now, our team consists of we are two doctors and 7 nurses, and we have 1 charge nurse, 1 lead nurse, and 1 occupational therapist. Of course, we are looking for a physiotherapist and a speech and language therapist and a dietitian. So the team is expanding. And 2 years ago, there were nobody there except me. I was in my own for 1 year, and then those people who came in just in the last 2 years. Yeah, next. Now, we are located in Psychiatry Department. This is where outpatient clinic is, and this is where the clinics are. It's an old building. It's the most the first hospital in Qatar. There will be another building. It's built nearby. They're going to finish next year. So this will be representing the new modernized wards and clinics that we could accommodate a higher number of people and better to provide better facilities. Next. Now, this is where Ma'ader is like, it's a rehabilitation unit. And this is where the people with disabilities spend the day time, and we have few who live there as well. Who live there, the government stated that they have to be Qatari. They're not gonna bring Indonesian people. Yeah. Yes, but the daycare, they can accommodate anybody. They can come during the day. Now, even the daycare, the COVID situation has been like putting some restrictions. So now they are back again to rebuild again the services. So next one, please. Yeah, I can move from here then now. Okay. Now, Inaya is the medical, where the medical city is. Inaya has got people with long-term special needs, also Qataris. I know it's because what's happening here is that because the government have to pay for long life on healthcare. Yeah, they not get just on going for one night or one day. So they also providing this to the Qatari, but it's there. We keep a higher number of people there for they stay here for years, and of course this is like a medical ward, but for people who have physical and intellectual disability, both physical needs as well, like a nursing level, they need to get like high health care constantly. Yeah. Yes. Okay. Now there are other medical wards here, long stay wards in Rumeila as well. The same thing, but it's different. Like this is here more of investigations. Like if you like to do more intensive investigations, like atomic pain, need an MRI, they need a hip replacement operations, this kind of thing. They move into the Rumeila hospital. Now we have Shafalla. It's a school, and they're accommodating Qatari and non-Qatari as well. This is a special need school, a governmental. I think there are other schools as well, but this is one. This is the main governmental school. Beside Shafalla, we have Best Buddies. Best Buddies is like a shared like charity. It's a charity to provide like activities to the people with the special needs as well. But again, we're gonna talk. I mean, the special needs centers are mainly there are private special needs centers, and there are some charities. There are some rehabilitation centers around the country that belong to the government. So we have all the. If you're in touch with us as a team, we can facilitate joining these people into these centers, and we can cooperate with these centers on your behalf, and you can also ask them to do whatever you want. So these special needs centers are spread all over the country. Yeah. Now Qatar here also now, you know, for they support people to work. And you know, as you know, if you go to Indonesia and you are Qatari, they're not going to give a job to a Qatari in Indonesia as a priority. It's a governmental sector. So the same thing for Qatari here. They're not going to give it to the Indonesian as a right, but they can be appointed as an Indonesian in the ministry if they are able to do some work. They can apply for work, and they can be appointed if they can do some work. But if they need substantial support, like, you know, day by day and supervision during the work, it might be difficult. Yeah, but for Qataris, they give them jobs. Yeah, but the challenge is they get salaries, but the challenge is how to support them during the work. You know, what to do, what facilities, which job should be given. This is still building up with time. It's still not you know, framed as it should be, because that guy, if he has special needs, for example, he has Down syndrome, okay, and go to work. So we need to find which work exactly needs to be given to that gentleman, and then after that, what kind of support, and what if anything happened at work, how we can change, how we can support, how we can make things better for that. So it's not an easy job. Can you move, please, from your side? Yeah, there are some conferences as well. They're looking after, you know, that is like the image that we have to give to the international world. And Qatar is even brought me to look after these people. So it's not, it's an effort by the states of Qatar to look after these people. And because of me and my colleague, we brought this experience from England into Qatar. And I can say to you, you know, I can say to you confidently that this specialty does not exist in the world, except in England and even in some countries. They might say there are people who look after people with disabilities, but they're not doctors looking at healthcare of these people. So we might find teachers, we might find people like support workers, we might find some charities, some organizations, they occupational, speech, but you're not going to find, you know, in other countries, a healthcare specifically for people with disabilities. This is where Qatar has been, in advance on other countries, particularly the Gulf countries. Yeah. Now the disability, as I told you, we talked about this before. Can we go move to the next one? So disability is, we talked about the IQ test and about, you know, behavior. You know, can you move to the next one? Yeah. Okay. So this is where the levels of disabilities, you know, this is where we divide them into 4 categories, and the mild disability, where the IQ test scores 50 to 70 or 55 to 70, but they are the majority who are mild, only mild. They are majority, and the moderate between 35 to 55, and they are around 12% of the people with disability. The severe and profound, they are the minority. LD, learning disability, like intellectual disabled. We have 2 terminologies. We have intellectual disability, we have learning disability. The same thing, but we prefer as an academic, intellectual disability. So this is the category. So for example, like a person who comes to you and they would like to see, first we have to assess level of disability, and because this will come as out of their assessment, that we see this person is able to understand some of what I'm gonna give him. As a doctor, I'm gonna speak to them, I'm gonna give them instruction, I'm gonna engage them in the treatment. So I need to know the level. If the level is really like too low, like severe or profound, then the communication is little bit has to go down, and then engage them in a way that we can some aspects, but there are other aspects they're not gonna grasp. So, but mild, if they are mild or borderline, if you don't engage them and they understand the conversation, you know, they might get frustrated because you are talking on their behalf, and you are, you know, you are taking decisions and you're not engaging them, and they might get angry, and sometimes they will refuse to engage, and they will object. So you need really to be careful. That level of disability is important to be assessed before we start doing any assessments or any treatments. Next, please. Now there are, as we talked before, the first when I started, you know, there are reasons before the birth, there are reasons of disability during the birth and after the birth. I could take off all of that. Most of the reasons, most of them are unknown. We don't know exactly what could be exactly the reason, but there could be an autism, and which is polygenetic, like different genes and the chromosomes. And I've done some studies on genetics in the past, and I've done that for a period of time. Even during my training, I've done some genetic clinics. The genetics are really heavily involved in majority of the cases, but sometimes we don't know exactly which genes. And if you know the genes, sometimes there are many genes, like 6 or 7 genes. We don't know exactly, is it a combination of genes that causing this thing, or this condition, or one of them, you know. Sometimes infection before birth or after birth, meningitis, one of the common scenarios, meningitis, when there's infection to the brain and then become like disabled, the child. Of course, there are some thyroid, you know, some insulin problems, like pancreatic problems. You know, the hormones can be from birth. It will be shortage of hormones, and then this might lead into this disability. Now, you know, I hope I can do that. So yeah, okay, right. When during birth, I think during birth, lack of oxygen, it's one of them. If the cord is around the neck and the pull, yeah. You know, but I during my assessment, I don't take things for granted. Even the mom said to me, this is the cause of the disability. It might be not. It might happen, but it might be not the reason. The reason might be from the beginning as a genetic. But the people start to think, okay, but possibly because the cord was there or no oxygen or something. We have to really, if I see it's adult or a child, and they have dysmorphic features, that the fingers, I look at the fingers, I look at the chest, I look at the head, the ears, the mouth, the eyes, you know, the look, the status, how short, if they're obese. If they are looking dysmorphic, we call it dysmorphic, that means I might have to look into referral to a genetic clinic. And it's in medical city, Hamad Medical City. We do that test. I don't take just everything granted that this is assumption, that this is because of the short of oxygen. The hemorrhage, of course, the hemorrhage comes back because of the pressure on the head or that kind of thing, the pulling. After birth, postnatal is after birth. I would say after birth, minority, they develop injuries during the childhood. Mainly falls from heights or injury, or most of them, or infection, as I said, like meningitis. But most of them, they come before or after or during. Yeah, can you move this? The challenging behavior, it's a terminology we use when the person who is, you know, disabled, like for example, 20 years old, a teenager, okay, and she is a girl, and she is growing, and she is becoming bigger and bigger, and she start to want to do, for example, she wants to experience her freedom, okay, and she's mildly disabled, but she doesn't understand everything. There might be, as I told you, she might start to think about, to want to communicate, to get married, okay, but she can't do that like straight away, because decisions regarding she can engage with that guy, or she want to take decisions regarding this marriage, or to care for children afterward, or to control the environment at home. This can be really challenging. So challenges can come as frustration sometimes, okay? So these are the types of challenges. Could be an aggression, could be verbally, could be physically, could be self-harm with hitting like this, or banging head, you know, or destructive behavior like throwing things, you know, and could be hyper, could be not sleeping at night, coming inside, out, restless. And of course, there are many habits can develop with time. Okay, next. Yeah, so during the first time I see the patient, or I would say the person, I see that we call it 1 hour consultation. I'd like to hear everything from birth until now. We take something called developmental history. I take it from since she birth. The purpose of this is to understand the condition, to know exactly what happened during life, and to know possibly the delay, when it starts, what age, what happened at that time. Has there been any admissions to hospital during childhood? Has been any treatments? Who diagnosed them during childhood? For example, they've been in other countries. Okay, what happened in that country? What happened in this country? What happened in that country? How successful was it? Why and how the journey started? This is one important thing. We take the information from parents, and we take it from could be brother, could be sister, somebody who is informant. We take that history from them. Of course, they can tell us. The person with a special need, they can tell us things. We take some information from them. But I think from my experience, 90% of them, they give very limited information about themselves. Exactly. I mean, they can tell, but not the history. Okay. Now, we ask also about medications being given, because part of my job is to prescribe a medication that made that person better. This is the main aim. That's why you come to me with your child or with your adult, like for example, and you say to me this. I said, what treatment he has got or she has got before, and then we say, how successful was it? What went wrong? Why this person is not responding to medications? What medications options available for me to give? So I start to think. So, and why I'm given this medication? Do I have an accurate diagnosis? Is this person, I know what exactly wrong with that person? Is it autism is the reason? Is it boredom is the reason? Is it a sibling or a brother or sister teasing them all the time? Or is it children are making noises around them and they can't tolerate that? Is it because they want to work, but they can't work, frustrated? Is it because they are not being given, they left school and they're at age of 18 or 21, maximum 21, Shafalla school, they leave the people to go back home. They don't come back to school again because school time finished. Then the person comes and say, what should I do from now? So these people become frustrated and possibly they don't talk. Particularly people with autism, they're not verbal, they don't talk, they don't speak. So what happened to them? They stay at home for 60 years until the last day of their life, doing nothing, which is different than me and you. I go to work, you go to work. Okay, if you don't go to work, at least you get married and you get some children. At least you get some work to do with the children. Or if a man will get a job, or even no job, he does the voluntary work. They do traveling, PlayStation, anything. But these people, they wait for you to give them something to do. They can't do it. They do it like this 60 years. So from age of 20 and age of 80, this is expectation of life for people. I'm saying 60 years. So what they're going to do with 60 years? Okay, next. Just can you just make like yeah. I think the last few slides and we finished. Yeah. And then we can open for questions.
Like 15 more minutes. 15 more minutes. We still have 15 minutes.
15 minutes more. Okay, we'll finish within 15 minutes,
Okay.
I think, maximum. But with the questions after that. Yeah.
After that,
Yeah.
yes.
Okay. Now, assessments. We start, I think, what we do after this 1 hour assessment, I tend to send for blood tests. Could be immediately, could be later. You know, it depends on my thinking. If this person, I think I suspect this person has got medical health problems that can cause this challenge and this problem. I give example. No, now sometimes patients come to me, or and they say that he is refusing to go to the kitchen in his own. We have to hold him, or he throw himself on the floor, and he has Down syndrome. So, and then they start to cry, and then if anybody comes to him, he hits him. So I could suspect something like something wrong in their hip or knee, and so I start to think that I would try to send this person for an X-ray or something. And many times I found that these people has got sometimes a fracture or a dislocated knee or problem in their ankles, because they're born with a deformity in their feet sometimes. So they walk like this, tilted all the time. It's painful. It's not an easy thing. So if it's painful, they can't walk, you know. And if you come to him and say, come on, walk, they will hit you, because they can't say, I have this thing. Can you treat this? Can you take me? So sometimes it's important for me to do blood tests and investigations during the assessment. Communication assessment, again, part of the disability level. When I give assess the disability, what I should do, I talked about this issue. It's a communication and social disorder. Most of the people with disability autism. So we have to really know exactly, are they able to use single words? First of all, are they able to speak? Are they able to use single words? Are they able to speak a small phrase, simple phrase, or combined phrase? Like, I will go upstairs and bring a towel. This is combined. This level is different than, I want this, I want that, give me this, give me that. This is less. Yeah. So, and also how much they grasp the receptive language, how much they understand of you. Sometimes they keep silent, but silence doesn't mean that they don't understand. They understand a lot. Never talk about them in front of them, and do you think that they don't understand? Sometimes you don't understand first time, but they might understand second time and third time, and they might become challenging because you talk in front of them. So, and their level of disability, it could be like IQ 20. Imagine a child without disability, and he is six years old, just 6 years old. How much he grasps of a conversation between mom and dad? 90%. He would understand there is a problem at work with father. You understand that mother and father are not getting well with each other. You understand why this father is angry. You understand why mother is not doing this, and that's 6 years old. And moderate people with disability, they have an average of 6 years old child. So communication is important. Functional analysis is where we assess the daily activities of daily, like when they wake up, they go and wash. Anybody help them in washing? Toileting, bathing, dressing. Who helps them? Do they do it themselves, or they need somebody to do it? And how much the level of their helping them? So, for example, if you go to the kitchen, how much they do? They can do a sandwich. They can do a cup of tea. They can do a microwave. They can cook in a pan. They can heat food. They can open the fridge and choose. Like a big, it's a science. It's not an easy thing. You need to know exactly what. Of course, I don't do all that myself. Sometimes from one look, I would say I know. I mean, because I see patients every day. I know. I don't need to ask these questions. I know how much level. But if you want to do it properly, okay, yeah, it's a big thing, work. And of course, we talked about the IQ test. Sometimes I refer for the IQ test. I think I don't usually refer, but if I want to refer, for legal reasons, sometimes courts, sometimes for medical reports, if I would like, I'm not sure. If parents really insisting and they want to do it, okay, I'll do it for them, that's fine. For my purpose, sometimes I do it if they are really, really borderline. They are, you know, they are, I'm not sure, are they disabled or not, you know. I mean, I said to you, my experience, I could get like 95% of people without any problem. But if there are some minority 5%, I'd say, just in case, if parents or the family challenge me and say, no, but how you know? He's quite, he goes to work every day and he's married, he's with children. How are you disabled? You said that he is disabled guy. I would think that if in this situation, I think that the family are not going to be difficult for family to understand this complexity, I'll send them for IQ test. Now, referrals happen to do genetics for them or to refer them to epilepsy clinics. Sometimes, you know, the reason for the problems that they might get epileptic seizures, even if they're not thrown on the floor or they're not shaken, they can get a silent epileptic seizures. They just stare on the ceiling like this, and then they come back again to normal. This is as simple as this. Even during sleep, they might get hundreds of these, and it's very common. Around 30–40%, they have epileptic seizures. I'm not talking about just autism. I'm talking about the whole people with disability. The more disability is physical disability you have, the more epileptic seizures you're gonna get. So I refer to epileptic seizures. I prescribe epileptic seizures medications, but I don't follow them for the long term. So I can give medications for them. If I'm concerned that it will take long for the neurologist to see them. But at the end of the day, I can give them medications to start with, and many I had, you know, found that, and I give them, and they became very stable. They became challenging, and they became very stable. This can be one reason. That could be a referral to epilepsy clinic. Dental. Oh, don't underestimate the dental work and pains. Cardiologist. I refer many patients to cardiologists because deformities, like if the person has got a syndrome, they come with the face, nose, ears, brain, heart, kidneys, all. I suspect that could be a problem there because they were born with this a problem. It might be kidneys are not doing well. Yeah. Can we move the next? Yeah, this is the most important slide, and this is the last slide. I mean, I put everything, condensed everything here because I thought if I'm going to do this, it's going to be in itself a one-day presentation for me. But I'm going to just go over it just quickly. But we could do another day for this, just for this. Now, medications usually prescribed for a reason. I don't give medication like for no reason. I need to get clear diagnosis. Or I suspect there's something there. Most of the time, I give medication for example, hyperactivity patients. They are really restless, moving around, and they are. Anybody asking questions? Later, yes. Okay. Yeah. Okay. They are hyper. They are restless. They are moving around. You know, they are not focused. You know, this hyperactivity is part of the condition itself. With autism or a condition like Prader-Willi-Williams syndrome, this syndrome, genetic syndrome, it can come with this way. And medication like methylphenidate, it's a cure for them. It's of course it will eliminate the ADHD. There will still be disability part. There are other things to do, but when you treat the hyperactivity, you know, the patient, you will feel like 50% of problems has been resolved, 50%, but there will be problems, of course, other problems remain. Mental illness. Why mental illness is common? Because it's you know, if they left school and they stay at home 3 years, most of them they come to me. Left school, they came to me after 3 years, okay, and they bored. What they do? There's no meaning of life after that. You know, and they come with depression. I give them antidepressant. 2 weeks. 2 weeks, you will see improvement. But it's not the answer. You have to engage them in, you have to tell the family, this guy should not stay at home from now on. You engage them in a special needs centers, rehabilitation centers, find them work, okay, charity work, even unpaid work, even activities at home, outside. So you need to populate the whole day for them. Sleep disturbance is big problem as well for them. You need to, if I don't sleep, I am adult, I have no problems, and I don't sleep 3 days, you see how much you feel, how awful you are. So it's sleep. If I don't solve sleep for my patient, the patient will still suffer from it. And the aggression. Sometimes over and talking and hitting and banging head, you know, moving around, slapping people. I mean, unintentionally, because possibly they are, you know, heightened for some reason. As I told you, we need to know the reasons. You give them some calming medications that to calm them down a little. You know, this is to reduce their annoying, and they make them like a little bit more calm and little. We could use something like anxiolytics or like antipsychotics, but antipsychotics not for mental illness, just to reduce level of arousal. Now, we treat also the physical problems like constipations. Is common, very common. You know, if it's constipation is there, you will see problems with that guy. Epilepsy, as I told you, we already talked about it. Infections, particularly girls, you need to check urine. You know, if she goes to toilet many times, you know, if the periods, menstrual periods also can cause problems as well. Sometimes you don't need it. You ignore sometimes because they are disabled. You ignore these things, you know, but you never complain. You never complain. You will see them agitated. You will see them challenging. But the reason is could be possibly is constipation, dental, epilepsy, infection. You know, these kind of things, and acidity of the here in the stomach. This could be one common reason. We do something like behavior adjustment and then intervention. Of course, I have a nurse for that. We have a group of nurses. I send this nurse to the person, and they collect information and they analyze it and see exactly what happened to trigger this behavior, and what happened during the behavior, and what happened after. And then we can come back with a plan of what we need to do as a family, okay, to reduce that behavior or that challenging or that thing. So it's a big issue. You know, it's a big talk. It needs like more time to talk about it. It takes time, but this is the main thing. The main idea is that the nurse job is to do that job, is to analyze the behavior and then come back to me, and then we discuss it, and then she come back to the family, and the family will implement these changes. Social care, we also already talked about it. Also about activities. We try really to look at the activities, what exactly from wake up until sleep, you know, and see where is the challenge, where the problems happen, and what they've been doing and what we could do. So we could populate. So we say that time where for example, when they come from the school, and then the challenge starts after coming back from the school. So it means like the school setting, they are able to make them, they have a much structured activities, because on time the class finish, then break 10 minutes, then lunch 5 minutes, 15 minutes, then after lunch they come back to his class is that, but at home they are like here, there, mom, dad, downstairs, I see, I don't see, they are lost. So they start to challenge. So this is where, if you find this is a problem, so they have to structure the time at work, at home as well. Yeah. Now, family. Without family working with us as a team, we're not going to do any progress. There are some families, they think that just open your mouth, take the tablet, and the person will be, good well. They have to work closely. They have to do the efforts. They have to implement changes. They have to come back to me, to us, and then make adjustments, make changes. Of course, that person has disability. The expectation is not that high. You have to really go low, go down, 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 and just work as that level. Just make sure that the family working with you and understand you. Carers and support workers, this is again a big talk about it. I mean, I say for my side, this is what's lacking in Qatar. There are no specialists. I could say recruitment agencies. Like, for example, recruitment agencies can bring people specialized in special needs that can be with that person and can, because 24 hours, I see the patient once a month, maybe. The nurse will come and see once a week, but who lives with that person? Family, and could be support worker. So this is where, this is what's lacking in Qatar. This is a big business, and it's lacking in Qatar. Which is why is it business? Because we have a lot that needs that support worker, that befriending, be understanding what to do with these people, how to manage them day by day. Now, communication assessment and management, we do communication assessment, as I told you, but there's a speech and language therapist work. Again, this is what we are asking for. We're gonna get something in the future. But we haven't. But we, as doctors and nurses, we do communication assessment, but it's not detailed one. As we see, that communication by using pictures, sounds, okay. Sometimes sign language, simple sign language, simple, okay. Sometimes when during childhood, they already have their own language, sign language, So what exactly the language that person is using, how mom and dad communicate with them, so I have to understand. So we have to use the same language. Of course, we have to improve the language communication, because it's important to engage them, to know. For example, person with autism, severe autism, how do you engage them in communication? You bring them a chart, big one like this, like a board, and you put the hours, and then the time, and then you put the activities, picture of activity, and then after that, the time finished, okay? So they will know what's happening during the day. And day by day, Monday, Tuesday, Wednesday, Thursday, so they know what exactly. It's in the wall, and it's there. It could be an iPad. This is one example of communication. Now, physiotherapy, again, as I told you, that person with a deformity in his feet, or a kyphosis like this, and they're walking like this, or they are limping, it's painful. You have to consider that as well. We don't have physiotherapists. We're also asking for a physiotherapist, but we can use physiotherapists from the Psychiatry Department, but they're not for us. Again, it's a big issue. Dietitian, obesity. Listen, women or a man. But I think men, even if they know obesity is a problem, they don't care. But women, obesity, why women lose weight? Because of two reasons: health and look.
Yes.
Yeah? So she decides that. But for people with disabilities, they don't think is I'm pretty or not pretty. She doesn't get this thing. So eating. Yeah. So that decision is really difficult to lose weight. It's not an easy thing. And I went to a few projects with this thing, research projects, and I found that really it's quite difficult. We ended up with what? Give them injections and that's it to reduce weight. Because decisions is difficult. There are injections to reduce weight, reduce appetite. They we do referrals to the Qatar Obesity Center, and they do injections for them, like I don't know, possibly once a week or something. They do once a week, and then they reduce appetite, and then they start to not to eat. Because you work on capacity, you're not going to get capacity. You're not going to grasp that. One last thing I forgot: possible social work. Social care is important, as I told you. The government of Qatar, they give around 7,000 Qatari riyal for each person with disability. They increase it even to more if there are more one disability. That, for example, if there's blindness or deafness plus autism, or cerebral palsy with the disability. So they will give more, around 9,000 sometimes, and this should be spent on these special needs centers. Now, yeah, yes. Then I finished now, so I'll move to Mrs. Dina.
Yes.
Back again. Yeah.
Right?
Yeah. I'm fine. I can
You
answer
sure you
like
don't want to
this.
sit down?
It's okay. I'm fine.
You may take a little bit of a drink first.
Yeah, a little drink. Yeah.
Okay.
Yeah.
Wow. Wow. Turns out there's a lot that we have to think of talking about disability, doctors. So I would like now to open the floor for anyone who have questions.
They told me like, okay, you have already referral to Hamad. So for Sidra, we cancel. So you go with Hamad. And then we got the Rumaila, as you mentioned. We had the treatment there. So actually, if we have this kind of condition, what is the standard procedure in Hamad? Where should we go?
For non-Qataris, yeah.
For non-Qatari, yeah.
For Qatari, okay, I understand you. Qatari and non-Qatari are the same for this process. The only difference between non-Qatari and Qatari is just on the social care, like allowance, social allowance. They don't give it, they just give it to Qataris, and the long-term stay. This is the only, but otherwise, Qatari and non-Qatari, they receive the same exact service, the same exact thing. Now, regarding the patient, if the child is under 7 years, you will be seen in Rumaila, CDC, it's called Child Development Center.
Yes.
If over 7 years, they will be seen in Ma'idar, the same place I showed you, Ma'idar. Between 7 years and 18 years, they will be seen in Ma'idar. If the patient is over 18, they will be seen at Hamad Hospital, which is me.
And for this, let's say my son is 6 years now. He's been taken care in Rumaila. When he's turning into 7, will it be automatically designated to that wider service, or we have to do all over again, come to Hamad?
No. They will just transfer the care. You will see the next appointment will be with the other doctor in Ma'idar. But the doctor in CDC will make a referral on the system, in his system. So you see him for the last time, and then they will make a referral to that, and they will not start again the assessment. But the new doctor has to know that person. They will look at the records, and they will just do their own follow-up assessment. You know, it has to be for another hour, but it's not for you to do any more referrals. The doctor will refer from doctor to doctor. Every step from 7 years onward to 18 years. So it will be before 7 years, one doctor, after 7 years, another doctor, and then the 18 years and over another doctor. But, you know, for any procedure in Qatar here, it's better to stay with Hamad and or the governmental like Rumaila, because there are some legal issues like medical reports, like course, like something like, you know, you need some medications or some of what I mentioned now already of treatment options. It's better to stay with Hamad better. And the governmental rather than private. Private, okay, but I could suggest that if you want to do anything private, consult the doctor in Hamad or in Rumaila or CDC and say, would like to do this as a private, would it be advisable to do it? And the doctor will give you his opinion. Private is also more welcome if it's making things better and they're helping out. And it's helping the treatment options, treatment plan. Okay, thank you. So we have here the first question.
Yes.
Done?
Can I have one more or not?
No, we have some more.
He's the lead.
We have some more. No, you have to listen to me. Okay, so the kira-kira saya terjemahkan sedikit ya barangkali ya Bapak dan Ibu-ibu. Jadi Dr. Rustom menyarankan untuk tetap stay di rumah sakit yang nasional gitu ya. Jadi stay di situ dulu karena apa? Karena memang secara sistem itu lebih connected ya, dan untuk sampai 7 tahun itu di CDC. Setelah 7 tahun, dokter dari CDC yang akan merefer ke yang di Muaitir ya. Dan memang untuk step by step-nya itu barangkali butuh waktu, karena pengalaman dari Ibu sendiri nanti bisa dengar dari Ibu juga ya. Ibu juga melewati beberapa step untuk bisa akhirnya sampai ke Dr. Rustom, gitu ya. Jadi stay with the Hamad, and after that just wait whatever the doctor is telling you for referrals and the continuation. Please, doctor.
One thing just would like to add: if any from Indonesian society. If Indonesian society they have a child and they would like him to be seen, they can come to me first. It's okay.
How do they do that? How to get to you directly?
I think they have my Ayman. She has my contacts.
Oh.
Yes.
Oh, you're okay with that?
Yeah, I'm okay with that. We can organize this thing.
Okay, so we have PSG at the moment. So the dokternya sudah bersedia untuk dihubungi secara langsung, Masya Allah. Dan mudah-mudahan, tetapi kita juga tidak bisa langsung memanfaatkan begitu saja ya. Jadi kita di sini punya PSG, so I would rather sesama PSG yang mengkoordinate. Jadi
Yeah.
nggak semua ke dokter aja ke dokter gitu ya. Jadi nggak kayak gitu juga caranya. So we have to do it in the
Yeah.
right way.
I do the referral for them.
Yeah.
I don't do I'm not going to be the doctor for them, but I will see them for the first time and I do referral to them so it can be seen by whatever. And if any problems, I can solve it for them. It's no problem.
So nanti akan dikoordinir dari PSG ya Bapak Dewi. Saya juga nggak menyarankan untuk langsung ke dokter barangkali ya. Jadi lewat PSG, kemudian kita bisa koordinasikan dengan cantik, dengan cantik ya nggak langsung aja. Okay, thank you, Doctor. So we have another question from the participant online. So from Ibu Fajriati, I strongly relate to what Dr. Rustom has said about hope for adults with special needs. My experience as a parent of a child with an autistic syndrome who is now growing up 20 years old finds it difficult to get services, including further education that can accommodate his needs. For this reason, is there advice from Dr. Rustom about the steps that the parents can take to get treatment? So this is for older.
Yeah, he can be
older
my
children.
patient. Over 18, he can
Yes,
be.
20 years old.
I can be the doctor for him. You know, he can again. I can see him in my clinic, and of course, if you can provide me with the details, I can give him an appointment with me. In terms of the treatment options, I don't know what problems they have. I mean, if it's like for example, educational, I'm not sure. We need to know the problems.
The assessment.
Yeah, do assessment and they see the problem. But I think it's education. We need to sit and talk about it. What are the needs? But I can see them.
Yeah.
Yeah.
I'm sure most of the parents here already have a preliminary diagnosis from their children, so probably they can go from there and come to you.
I mean, the condition itself is if somebody has got disability, my job is not just to diagnose them with disability. No, the problem is if they have problem after the diagnosis. For example, the person can't sleep, person is lonely, person is have challenging behaviors, person has got problems with the people, they can't do things. There are not just because of people. The person has got autism. You have to come to me. I'm a doctor. I'm not. I need to treat a problem. If there is no problem except autism or disability, I don't need to see them because they live their life, as it is. This is their life. But if they want to be seen for a problem, as I mentioned, they come to me.
Oke.
Ya.
Oke, jadi barangkali ibu-ibu dan bapak-bapak di sini sudah mempunyai diagnosa ya untuk anak-anaknya. Akan tetapi bisa datang ke dokter kalau dengan disability-nya itu juga mempunyai keluhan-keluhan tambahan, barangkali yang baru muncul atau yang baru terjadi baru-baru saja gitu ya, yang di luar dari kebiasaan sehari-hari. Ya, jadi kalau misalnya memang kita udah tahu misalnya anaknya ADHD gitu ya atau autistik, ya udah normal, akan tetapi kemudian timbul simptom baru atau yang belum pernah sebelumnya, then it can come to Dr. Rustom. Gitu. Ada pertanyaan lain? Silakan. Mike.
Yeah, come here.
Thank you. Sorry, my question.
Mike is here.
Oh yeah. Okay. My name is Hendriadi. I'm a student in HBKU and also the fellow in UNICEF in Qatar. And then I'm doing child protection and then a social service workforce research. So I'm like following your presentation about the number of care work that we need. So if you can give like explanation, what is actually the status quo, the numbers of children with disability in Qatar, and then what's the minimum numbers of the social worker, and then maybe like the care worker that we need that they can support the families of the family who have children with disabilities. So that's my question.
Yeah. Okay. Right. It's about statistics. I mean, usually it's around. I mean, there's no specific statistics for the whole. I have statistics for Hamad, for example. We have statistics for Shaqalla, the school. There are statistics but I would say to you that there's no specific You can sit down. But around 1% of people, of the population, this is the way they estimate that one. Worldwide, 1% they have disability. Now, how much of this 1% have autism could be, a proportion of it. So I would say in Qatar, we estimated around 900 people with disability. They have disability. Qatar, just Qatari. Non-Qatari, maybe another, because most of them are workers. They don't come with families.
Yeah.
It's difficult to estimate. So, for example, if there are 2,800,000, you can't estimate from 2,800,000 of them, because there are 800. They're single people. They're coming from Qatar to work. So the society here is little different than other, like Indonesian society. So if you say Indonesian, 1%, if there are, for example, 280 million, how many in Indonesia?
270 million.
270 million. So 1% is 280,000, or how much? 1%? No, 28,000. 1%. 280,000.
2.7 million. 2.7.
2.7. Okay. So 1%. But for here, it's around we count from Qatar. Qatar is around 400, 500,000.
Yes.
So you say 1%. So this kind of it, but there's no specific. I mean, I have 400 patients in my so around half of the this number is under my care. Of course, my colleague care as well. We have our 2 doctors. So this is my answer. Yeah, they didn't count them one by one. They didn't count them one by one. Yeah, but this is the estimate. Yeah.
I think the number might be bigger, doctor, because not everyone comes to the doctor to get proper diagnostic and assessment. Would that be possible?
Yeah, the 1% is 1% is it's sometimes 1.5, sometimes 1%, but none of all of them they need a doctor, as you said.
Yeah.
But we are counting 1% as in general, not for the people who come to the doctor. Numbers, I think they are still developing these kinds.
What about the awareness of the Qatari people about this kind of disabilities? Is that widely known?
Yeah. They have their own association. There is I think family autism association, something.
Oh,
Yes, they have.
Okay. Would it possible for Indonesians also to join that kind of association?
Yes, of course. Again, we'll communicate with you if you want. I mean,
I think
spread
that would be great. Yeah.
my communication. I think particularly the head of associations.
Yeah.
I mean, I'm happy to give them my WhatsApp.
Yeah.
You can send me, and I can cooperate with you to link you with other people as well.
So jadi bapak-bapak dan ibu-ibu dari PSG, terutama di sini ternyata sudah ada juga ya asosiasi untuk keluarga dengan autism. Jadi saya rasa sih bagus sekali kalau misalnya PSG juga bisa bergabung, karena not only kita bisa banyak dapat information from them, but also since we're living here in Qatar, I would think that would be beneficial for all of us. Inshallah. So
yes.
Yeah. Doctor, we take a break for a bit. Kita ada permintaan berfoto untuk teman-teman yang join secara online. So jadi kita kasih waktu sedikit barangkali untuk teman-teman atau peserta yang join secara online untuk membuka kamera dan kita foto di Pak Kris ya, Pak? Silakan ya, kita akan berfoto bersama dulu. Silakan dibuka kameranya bapak-bapak dan ibu-ibu online. Ada pertanyaan? We're taking some moment to take pictures for the people online.
Okay, yeah.
Okay. Oh, saya juga gitu. Silakan dokter, mungkin sudah.
Kameranya.
Kameranya Pak Kris.
Kita di mana? So you still have some question left, right?
Saya hitung ya.
1, 2, 3. Dua, tiga. Yang kedua. 1, 2, 3. 1, 2, 3. Terima kasih.
Ya, ya. 1, 2, 3. Ayo. 1, 2, 3.
Okay, we have another question from online. Bahasa, so I'm gonna take a while to
Okay,
translate.
okay. I'll sit down and take
Yes. Pas betul itu ya, malah mau lanjut apa sudah mau kita tulis sudah apa mereka tetap connected dulu ke depannya. Okay, there's this person already going to Sidra for treatment and consultation. So she's just wondering if she can go back to Rumaila after getting treatment from Sidra. Would it be difficult?
How old? Do you know? Does it say how old?
No.
Yeah.
5 years old.
5 years?
5 years old.
They are 5 years. They are with Sidra.
Okay.
With Sidra. Doctor with Sidra. Come here. Come here.
No, it's not me. It's from online.
Yeah, okay. Sorry. So.
Dia bisa dari situ nggak bisa nanya langsung ke saya.
So 5 years followed by Sidra.
This is not really clear.
Sidra, I'll just give you one thing. Sidra is considered as private. Okay?
Yeah.
It's not private, it's Qatar Foundation, but it's kind of private. This is a shadow of Rumaila, CDC, a shadow of the Maider and Hamad. So Sidra is a sideline for children and for women. So, you know, if the Sidra, if they can continue with Sidra, but if it's with Hamad, this is the CDC Rumaila, and then Maider, and then Hamad, which is me.
Yeah.
Yeah. So this is a sideline.
Yeah.
Sidra.
So she's been consulting to the doctor in Rumaila and was referred to Sidra from the doctor in Rumaila.
If she changes to Sidra, is it possible she can come back to Rumaila?
So go back to Rumaila because
Yes, the doctor can refer from Sidra to Rumaila. The doctors has, you know, the patient family, they go to the doctor and say, refer me on the system. Okay, from this to this to this to this is always possible, of course.
Well, only the problem
But
is
at this time, at 6 years, it's 5 years,
7 years. 7 years.
7 years. 7 years better to go to refer to Maider because it's already 6 years or 6 years or 7 years. Just better to refer to Maider. Yeah, when the time comes, the 7 years, refer to Maider rather than first CDC, then 1 year, and then again refer again.
Already 7 years old, so
7
just go to
yeah,
Rumaila.
yeah, Maider then.
Okay.
Yeah.
So okay.
Yeah.
Thank you, doctor. Any other question? Yes, question. Okay, nanti Pak. Okay, we'll go first.
Yeah.
Silakan.
Come here, please. Yeah.
Okay, silakan.
After like itu ya. Setelah ini.
Ya, gantian.
Ibu juga tanyakan.
Name-nya dulu barangkali.
Yeah, hi, Dr. Rustom. Thank you. My name is Marlene. I'm a mom of 7 years and 9 months boy called Elias, very lovely boy. So, long short story, I have noticed like quite a delay in his development since he was baby. But you know, baby being babies, I took him to the doctors. They told me, don't worry, boys tend to be slower than the girls. So it kind of put everything off my mind. Then we came to Doha in 2019. When we enrolled him at the school, Canadian school, then he faced a real struggle. Then I talked to the teachers. So I said, maybe the boy is kind of slow learners, you know. He understands the surroundings, but there are kind of symptoms or syndromes, whatever you call it. Then I consult with Dr. Nisrin. She's one of the famous pediatric as well in Doha. Then she talked to my kids, basically. She was talking to Elias for almost an hour. She told me, listen, you are a mom. I know that you have worries. That's normal. But as long as your son doesn't have any intellectual issue, then don't worry about it. He will pick up. You will see a big change when he reaches 9 years old. Then going to grade 2, out of sudden he stopped going to school. He would cry every day. He said, Mama, they told me that I'm bad. I don't listen. I don't do this.
Which year? How old?
He's 7 years.
No, grade 2, 7 years.
Yes, at the Canadian school. As per American parent curriculum, he's in the year 2. Yeah. So I decided that I wanted to go to the Hamad because the mom's instinct saying there's something wrong with my son. It's a lengthy procedure. It's a waiting list of 2 years for my son. So I decided to take him to the special needs center, the private. I went to step by step. I took the full assessment, which I paid. It's quite a lot of money as well for me. With no answers, they told me basically we can only say his strength and weaknesses, but we are not authorized to give the diagnosis as per Qatari law. I said, okay, well then, at least you tell me. They say it's something related with the social interaction difficulties. That's it. They gave me the report, but there's nothing mentioned in the report, like there's not even written social interaction difficulties, just area of strength, area of weaknesses. So I went to another special center because I wanted a second opinion. It's called Ontario Special Needs Center. Yes, it was very quick. It was very fast answer. Ma'am, don't worry, attitude issue. But come on, attitude issue. Everybody have attitude issues. Even a child without disabilities have attitude issue. Because a 7 years old wouldn't be excited and start hand slapping, you know, or he will sit back and forth, or he would not stay in the conversation when you ask him, Elias, what's that on your t-shirt? Ma'am, miss, I played Roblox. It doesn't synchronize the answers. He understands if you ask him again, Elias, how was your weekend? Elias, how was your weekend? Good. Did you go out? It's always one-way conversation. Yeah. So I took him then the last time I took him to the Leo Kenner. So the psychiatrist, she told me basically it is something with the neurobehavioral disorder. But she cannot say to me whether it's autism, it's ADHD, because she's not allowed to. So I'm basically looking for answers. So I know like what treatments that he needs. So at the end, I had to move him to join to another school, which is all-inclusive school with the Addison. He just completed his 1 month, and it was really a real struggle. Like he was very afraid with the changes. He refused to go to the school every day. Would be like, he cannot change the routine, even to try the shoes. No, mama, take it off. Even to try the clothes. No, mama, take it off. But other than that, like as you said, he understands everything. And he can make sentences and everything. So I'm basically personally looking for your help to be able to get my son into the system of like Hamad or Moela. Yes.
Does he have first question you can ask yourself question?
Yeah.
First thing, his intelligence level is normal?
You mean diligence or intelligence?
Intelligence.
I would categorize him in the slow learners. Comparing to his peers, he's kind of slow.
Second question, has he ever done an IQ test?
No, never. That's not.
Let's start with this thing first. Do IQ test. First, this is the first thing. Second question, does he look as an ordinary like look?
Yes.
Or does he look different?
He looks normal.
No.
Yeah.
Okay. My third question is, does he communicate with you as verbally in a full sentences, like talking, like as a level of his age, like combined sentences, like talk to her, to you, even for example, I go out and Mom, I want to go out and play with the football, play football, or I want to go and buy something. Does he use these phrases?
As simple like this, like on the daily life with me, he could. But as per his age and as per the speech therapists from all the 3 centers, his speech is still under. Like I forgot the percentage, but it's not up to his level.
Yeah. Speech and language communication assessment is one important thing. But again, you see, this is what he needs. He needs an IQ test.
Okay.
He needs possibly communication assessment. Of course, the doctor, I mean, if I see a patient, I decide myself what he needs. The doctor is the main one. I mean, what do you do? What are you doing? You going into private sectors where most of them are, I could say, I mean, I'm not underestimating them, but most of them, they are afraid to say that this person has got these conditions. So what they would happen then after that, you start to ask for certificates.
Yes.
For him to go to schools, to go to the ministry, to go and do that, and they can't give it because they're not allowed. The only person or the only team that are allowed to give these certificates, which is our team. So, or the either. This is why I said to you. Now, 2 years waiting list.
Yeah.
I mean, come to me and I will refer him and I'll see if I can facilitate this thing. You seen earlier.
Yes, this is that's
Yeah.
what I'm basically looking
Yeah,
for.
yeah.
Because I need an answer, you know, I want to
okay.
know like what kind of
Well,
condition
again,
it's
I
in.
can refer him and I'll follow it once he referred and seen. So I'll leave it with you, between you and the doctor.
Yeah, thank you very much. I appreciate.
Yeah.
Terima
Thank you.
kasih,
Yeah,
Bu
that's it.
Marlin.
Thank you.
Yeah.
Thank you. Okay. We're tight for time, so 2 more questions. Tadi Ibu silakan.
Please come in.
I'm Uli, mother of David, 4 years old. He is diagnosed with autism. We went to the private doctors, but follow up with the Hamad doctor as well. So they give us the group therapies for 12 sessions. Then my question is it 12 sessions is enough, considering it's enough for him, or they will give another session, follow up after that?
How old is he?
4 years, 8 months.
4 years. And what sessions? What
They
kind of
give
sessions?
him the group therapy sessions. So they give us like only for 12 sessions, and then
Therapy for what? What's the problem?
autism.
I know, but autism is not a problem. It's a condition. People can live without need for this.
Yeah, they give us this group therapy only, and then the speech therapy is not.
He needs a school.
Yeah,
He needs
I
a
give
nurse
it.
in a
Yeah,
school.
yeah.
The school is enough for a person with autism. He doesn't need to see doctors or to go to hospital.
No, we go to the Hamad doctors. The ones refer us to get the group therapies for him at the moment, and then they give us as well for the genetic test. We did already in Sidra, and they give us as well for the speech therapy, which is not scheduled yet. And then they give us for the occupation therapy as well. So when the occupation therapy are doing, and then the CDC was calling for the group therapy, the Rumaila doesn't want to do it because CDC did first, finish the 12 session, and then after that you can follow up with us again the occupation therapy.
Yes, because you already started the therapist, you can't, finish and start another.
Yeah, this is. But my question is this 12 session is enough for the kids, or it will be follow up again?
I don't know the exact progress. Is it progressing?
They said it's progressing. That's why they can release him. That's the only answer
The
that
therapist decide with you.
Mhm.
You have received. He has received the therapy. Do you see any progress with him? Does he see progress? Do you think that it's enough? It's not for me to decide. Maybe he's not progressing. Maybe he's progressing. Maybe he got the benefit of it, and that's it. But if people with autism, they're gonna live their life like this. The therapy is only to treat the problem.
Mhm.
Now, if the problem is communication problem, it's not for the hospital to deal with it. It's for the school to deal with it. There are special schools that is dealing with these children. They have them 8 hours a day, and then the 8 hours a day they can they have their programs, special needs programs, and teaching, educational, academic way that they deal with these issues. But for the doctors and hospitals, don't mingle yourself with this system if the only problem is just autism and there is no other problems.
Mhm. So I get it. So I guess it means that
So therapy for what should be for something specific.
Mhm.
I'm doing therapy because this child is slapping all the time.
Mhm.
I do this therapy because this child is going around circles all the time, and he's not I'm doing therapy because he's not sleeping at night. I'm doing therapy because he's refusing to leave to go to school. You know, I'm doing therapy because of this. So must be some aim for the therapy.
So it means that they will follow up again for the doctors after that, or?
My answer is, this is, as I told you, that answer is that therapy must be for a reason. And if the reason is there and is not resolved, therapy continues.
They will do it again and
Yeah, but from my understanding from you, that he doesn't have problems. He has conditions. That's it. And he does need to be in a school or nursery or school like for people with autism or special needs schools. Yeah, deal with teachers specialized in autism. Better than education, special education. Yeah. And then if there's anything else, again, you can contact me later.
Mudah-mudahan paham ya Bu Sobat dari Ibu nanti. Jadi intinya condition sudah ada, tapi untuk menambah keterampilan barangkali itu bisa dibicarakan di sekolah. Ke dokter hanya kalau misalnya ada sebab-sebab lain yang kira-kira risky atau membahayakan anak dan di luar dari kebiasaan sehari-hari. So di luar ya extraordinary causes that's not normal to the children. Gitu ya. Jadi one more question, doctor? Yes, okay. Silakan Pak. Yeah, because he's so eager.
Hopefully you can accommodate the
Just one question.
Just one question.
Yeah.
So continue.
Finished. So you can go back. No time for you.
So as because the special needs school is mentioned, Alexander was also attending special needs until he is recommended by the therapist to attend the mainstream school or the normal school. Now he's in the normal school under the recommendation by Hamad. Now the question is like mostly schools now are having like inclusion department, and some schools even have inclusion department only, and other schools have inclusion department with the centers. Like I know some schools with the special needs centers also. So my question is, sometimes they ask like, can you tell us the feedback from the teachers, what he's experiencing? The hospital also, the school also, can you tell us what's the hospital or the therapist need for us to do something? So we're like a broker information for the children what to do. So what my question is there any mechanism from the government, from the Hamad, to coordinate with these schools, because they have this Department of Inclusions? Maybe 2 or 3 years ago, 5, nothing is mentioning about inclusion department. But now most school like having inclusion department. But honestly, what I experience now in my son's school, I don't think they are working fully. So I don't understand what this inclusion department is for. Are they communicating with the government to, hey, we have this feedback for these children in our school. This school have this progress. What can we do to improve them better? And then the government say, okay,
just to answer your question, one thing, and how much have you done IQ test for him?
IQ test,
like intelligence test?
Not in Qatar. No.
So how much is he little mildly disabled? Like is his interage, or is he severely disabled?
IQ levelnya
No, he's not. He's even got many awards recently. So I don't think intelligence is the issue. Is what right? Fixed interest, dinosaurs, animals.
Yeah. Okay. Asperger.
And
but when you said to me dinosaurs, I say Asperger. Asperger type, where IQ test is higher than 70. Higher than 70. Yeah. Dinosaurs. I have many of these in England.
Yeah.
Believe me, American history and dinosaurs. Yeah, these are British styles. But anyway, Asperger, if as IQ, my advice for all these, if IQ test is important really for these children or for adults even, but if And special needs school is better for these people. But if the IQ is over 70, then this is why I'm saying to you, I don't know him. So I'm just answering you. I always advise for a special needs school. I don't advise for mainstream. I don't advise unless it is borderline or very mild and or over 70. If it's like IQ is a little bit down, like moderate, or downside of mild, like I don't advise for even special support at the mainstream. Now, this is one thing. Why I'd say that? Because these children will be always, getting bullied sometimes. They're gonna see themselves behind, bullied by their peers, of course. They're gonna see themselves behind. They always give them certificates. I mean, I'm talking about the system that it shouldn't be happening. Sometimes they push them class after class, but they're not making the successful marks. So they just push them to go with their peers. So they're not
additional stress for the children, also pressure.
Huh?
Additional stress for the children also.
It's, I mean, for example, they are in grade 3. They don't deserve to be grade 4. They still give them grade 4. You see, they don't deserve to get. I had patients who had a certificate, secondary school certificate, but they shouldn't take it because they haven't passed the exams. And the exams, if they're gonna pass the exams, they just pass them. So the special needs school will focus from the beginning. Okay, to give them according to their level. This is one. But for your question about hospital and school, my advice for you, because I do it always, I always do it. I have a nurse. I always say to the nurse, I ask her to call the special needs school, special needs center or school, and she get the information from school to me. And if they don't have a nurse, the doctor doesn't have a nurse. When you go to the doctor, bring that teacher and say, doctor, the teacher will speak to you. So the doctor will speak to the teacher on the phone. So if he can get a shared information about your child, this is one answer. I just get the number. I speak to the teacher. But of course, before patients come, she speaks to the teacher and say that I'm gonna go and be with the doctor. Can you answer? I'm gonna ring you. If I ring you, would it be possible to speak to the doctor? So we can talk together sometimes and share the concerns, make a plan, see what's happening, and then you would be aware because you're in the appointment. Okay.
Thank you.
Mudah-mudahan menjawab pertanyaan. Okay, so I think that should conclude our session for today. So everything is recorded, Bapak-bapak dan Ibu-ibu, but we'll take some time for the recording to be up, and for everyone who wants to listen to the recording, the full completion of the recording will be up at Indonesian in Doha YouTube channel. That's our channel from KBRI Doha. Jadi silahkan watch again from the YouTube if you missed some part of the presentation. Again, I would like to thank Dr. Rustom for a very, very insightful presentation and question and answer. Thank you so much. I know everyone here is they're all appreciative of whatever you just.
Thank you very much for.
So much.
I thank everybody for coming, and I thank Excellency, the Ambassador of Indonesia, for his invitation for today. I really thank for his wife, for all the society, Indonesian society, the friendly. This presentation, I would say to you, really made me very just like I'm visiting home.
Thank you very much.
Not as a conference.
Jadi that should conclude our session with Dr. Rustom. Saya Dina pamit undur diri, mohon maaf lahir batin atas segala kekurangan. Insya Allah ini akan mudah-mudahan bisa kita teruskan ya Pak ya.
Ya, insya Allah.
Kita semua Bapak dan Ibu di sini yang sangat suportif atas kegiatan-kegiatan PSG. Sekali lagi atas nama PSG dan Ibu Fajriati juga barangkali di Jakarta mengucapkan terima kasih banyak sekali untuk Bapak dan Ibu telah menginisiasi kegiatan ini. Selanjutnya I will hand things over back to our MC. Silakan. Wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih kami aturkan kepada narasumber, moderator, dan para peserta webinar yang hadir pada hari ini. The next agenda is a gift of memento will be given by His Excellency Riban Hassan, Dr. Hesham Rustom. Please come.
Dr. Rustom, on behalf of myself again and my wife and the whole members of our community here, I'm very delightful present to you one of Indonesian momentum to remember that you are part of our community. This is for you.
Yes.
Okay.
Oke, tangan yang tangan kanan, yes. Oke. 1, 1, 2, 3. Oke, semua 1, 2, 3. Oke, saya.
This is you can put on your desk or somewhere. And this one just to remember that Indonesia is very rich of many things. Yes. This is one of the woven from Indonesia just for your collection. Yes. Thank you very much.
Okay. 1, 2, 3.
Ayo boleh ikut. Oke. Ya.
Oke. Look at the camera.
1, 2, 3. Jadi mau ada mana?
Oke, 1, 2,
3.
3.
1, 2, 3. Oke,
Terima kasih. Terima kasih. Ya, terima kasih. Terima kasih. Thank you.
Yes. Where is my passport? I want the. You get everything except passport.
So, be at home. Baiti baitak in Arabic.
By what?
Baiti baitak.
Baiti baitan. Thank you. Yes. Yeah, your home is my home.
Yes.
Actually, I'm off during Ramadan, all April.
Yes.
I would love to spend some time little in England. I'm going to go to England to be with my family, but at the same time, I'm looking forward to go to Indonesia.
Ahlan wa sahlan.
So hopefully the border will be open.
Bali already open.
No, I don't want Bali. I want to go to see people, not to see just the nature.
Yeah.
I want to see people, society. I want to go and walk in the streets.
Right.
But I wish the best and prosperity for Indonesia. Open air, open borders, live normal life. Yes.
Start with small Indonesia here,
Yes.
and then you go to the big Indonesia.
Yes. My great pleasure
Yes.
meeting you all.
Yes.
I think it's anytime I said, oh, my man is having my contacts, I'm more than happy to help any Indonesian or any related, even not Indonesian, anybody.
Yeah.
I'm more than happy to help out. Even it's not my exact job, but I can refer and I can talk to other doctors as well. Yeah. Okay.
Makasih. Thank you. You do have some refreshment. Ya, foto bersama ya. Oke. Family photo and then go. Oh iya. Budina belum apa? Oke, Budina also ya. Oke. Moderator also get some.
Selanjutnya penyerahan plakat pada Ibu Dina. Dengan ini kami persilakan.
Boleh. Kok yang Ibu Dina ada fotonya?
Banyak, Pak.
Agak dinaikin.
Sorry, begini toh?
Ya, agak naikin ke sini. Yes. Budinanya agak ke sana. Enggak ke sana. Yes. Nah, ini cukup. Saya. Satu. Look at the camera. 1, 2, don't think. 1, 2, 3. Jangan gede. Satu lagi. Oke.
Terima kasih Bu Dina. Sama-sama.
Kita lanjut foto di depan.
Iya ya.
Terima kasih Bapak dan Ibu. Kami persilakan duduk kembali.
Oke.
Foto dulu sama Ibu.
Yang ini dulu.
This is the
Oke.
first time
Lihat ini ya. Kamera 1, 2, 3.
talk with this community.
1, 2. Yang ini ya. Oke. Terima kasih.
Nanti kita kiss picture.
Alhamdulillah seluruh rangkaian acara hari ini telah selesai. Untuk itu kami ucapkan terima kasih kepada para seluruh peserta webinar, baik hadir yang online maupun offline. Sebagai informasi, kegiatan webinar hari ini dapat dilihat kembali di channel YouTube Indonesia Doha. Saya Muhammad Fazlur Rahman Sari, mohon pamit undur diri. Mohon maaf jika ada kekurangan. Wassalamualaikum warahmatullahi wabarakatuh.
Ada pemilihan MC dengan suara yang merdu, maka Fajrul lah. Gitu ya.
Tapi tidak mimpi-mimpi.
Guys, my name is Saket. I am 13 years old. Selamat Hari Peduli Autism Sedunia. Bye.
Hi, Alif. Hi, Faika. Selamat Hari Peduli Autism Sedunia. Bye-bye.
Hi, my name is Muhammad Fayez. I am 15 years old. Sedunia. Bye-bye.
Hai semua, saya Iza. Saya akan mengucapkan selamat Hari Autism Sedunia.
Halo semua, saya Izata. Umur saya 20 tahun. Ucapkan selamat Hari Autism Sedunia. Dadah.
Nama saya Fadil.
Dan saya Aulia.
Selamat Hari Peduli Autism Sedunia.
Assalamualaikum, my name is Bill. I'm 26 years old. I just want to say Selamat Hari Autism Sedunia. Assalamualaikum.
My name is Dafa. I'm 19 years old. Selamat Hari Peduli Autism Sedunia. I hope you will be more aware and supportive towards all the people who have autism. Bye. Thank you and be more supportive.
Tapi tidak mimpi-mimpi.
That's the son of the chairman of the
Let's have a